double check to make sure that you turned off the stove. Well, if you're doing it 15 to 20 times a day, you might have obsessive compulsive disorder. Obsessive compulsive disorder is where you go back and you check what you did. You have obsessive thoughts and ritualistic behavior. There are 5 different kinds of OCD patients. There are washers that are afraid of contamination. They usually have cleaning or hand washing compulsions. They constantly wash their hands, and they have sores on their hands from washing their hands so much, and they have blisters. That is one sign that you might have OCD. The second type of OCD is checkers. You repeatedly check the stove to make sure you turned it off, and you check things such as the door being locked, and you associate it with harm or danger. And the third one is doubters and sinners. You're afraid to do something because you're afraid God will punish you over it. If you have those kind of thoughts, then you could have OCD. And also, the fourth type is counters and arrangers. If you constantly count your steps while you're walking, that could be a sign of OCD. And also, counting bathroom products, I've seen that before. And certain numbers and colors you're afraid of, and arrangements. And also, the fifth type of OCD patient is hoarders. You hoard up something, and it kills you to throw it away. You're afraid that if you throw it away, that you'll be punished over it. And usually what they hoard is things they don't really need, like paper and old clothes and things like that. Fear of contamination is a big one. A lot of OCD people have fear of contamination, and they constantly are worried about dirt, and they constantly have cleaning products everywhere, and usually their houses smell like bleach. And also, the fear of causing harm to yourself or others is overwhelming in their mind. Their brain gets stuck on something, and it can't get off of it. Like, afraid that you're going to hurt somebody if you do this, and it's just irrational thoughts. Like thinking, if I drink this, I'm going to hurt somebody. And also, intrusive sexual, explicit, or violent thoughts and images run through their mind also on some patients. And also, excessive focus on religious or moral ideas, and fear of losing or not having things you might need. That is also another sign of OCD. OCD can be treated with exposure and response prevention. It involves repeated exposure to the source of your obsession. Like, say you're obsessed with checking the stove, you automatically try to change your train of thought and not think about it, and then you are asked to refrain from the compulsive behavior you'll usually perform to reduce your anxiety. And also, there's cognitive therapy. In psychology, it focuses on the catastrophic thoughts and exaggerated sense of responsibility you feel. A big part of cognitive therapy for OCD is teaching yourself healthy and effective ways of responding to your obsessive thoughts without resorting to compulsive behavior. And also, they teach you how to relabel. Relabel means that you have to recognize that the intrusive obsessive thoughts and urges are the result of OCD. You have to realize that you have a problem in order to fix it, basically. And also, you need to reattribute. Realize that the intensity and intrusiveness of your thoughts or urge is caused by OCD. It is probably related to a biochemical imbalance in your brain. It really is not your fault if you were born this way. My sister has OCD, and she constantly washes her hands, checks everything, and she takes medicine for it. And if she doesn't take her medicine, she's even worse and constantly worrying and worrying. And this can be of great harm to your health, especially if you don't take your medicine. And also, you need to learn how to refocus. Work around the OCD thoughts by focusing your attention on something else. Like, if you're thinking about the stove, then think of something else, like go outside and walk or something. Do something healthy. Go exercise. That's one thing that could help you with your OCD. And also, revalue. Do not take the OCD thought at face value. It is not significant in itself. Tell yourself that it's just a stupid obsession, it has no meaning, and eventually maybe you can overcome OCD. OCD can also be treated with different kinds of medications. You can go to your doctor and they can treat you with a medication that is suitable for you. And also, just remember that OCD is very overwhelming, and it can ruin your life if you don't take care of it.